Since inception of the Opioid Stewardship Program at Mayo Clinic in 2017, we've really taken a number of steps to improve the way that we prescribe opioids, as well as monitoring patients who are prescribed opioids. And more recently, we've taken the step to take efforts to screen patients who are on chronic opioids for opioid use disorder. My name is Benjamin Lai. I serve as chair of Mayo Clinic's Opioid Stewardship Program, and I'm also an assistant professor with the Department of Family Medicine at Mayo Clinic in Rochester, Minnesota. The title of our manuscript is called Entering the Fourth Decade of the Opioid Crisis, an institution's effort to redefine opioid stewardship, which will appear in the September issue of Mayo Clinic Proceedings. As many of our readers will know, the opioid epidemic has ravaged the United States with significant numbers of mortality and morbidity related to this epidemic. The first prong that we take at Mayo Clinic is really to look at the way that we prescribe opioids and then to subsequently monitor our own metrics and to hold ourselves accountable. And one way that we did that, that's mentioned in the manuscript, is the creation of guidelines. We have guidelines for acute, subacute, and chronic opioid prescribing, as well as selecting patients who are at risk for opioid-related harms and subsequently might benefit from the use of naloxone. And so with these guidelines, we've actually housed all of these in an intranet platform called Ask Mayo Expert, where everybody at Mayo Clinic, as well as our colleagues at the Mayo Clinic Care Network, will have access to. And this forms our standardized guidelines, and we ensure that these guidelines are in compliance with regulatory guidelines, such as the CDC guidelines, as well as many of our state guidelines as well. The next thing that we do is to make sure that our practices are complying with these guidelines. And so in order to do that, we've actually created a dashboard, which everyone with access to our electronic health record system can use and look in real time what their prescribing metrics are. And both individual prescribers as well as our leadership can drill this down to the service level, the regional level, as well as down to the individual prescriber level. The goal is not to use this in a punitive way, but actually for us to look into how well each practice is complying with guidelines and also looking at trends. The idea is to be able to identify potential gaps in our practices in terms of regions or specific services and to see if we could improve our metrics. We also understand that our department and our quality leadership are very busy. And so one way to remind our leaders in accessing the dashboard is to use quarterly push reports. And we've pushed to our leadership on a quarterly basis to ensure that they're aware of their own individual department or divisions prescribing metrics. The other end of the spectrum is screening for and subsequently offering our patients with opioid use disorder prompt treatment. For patients and family members who may struggle with opioid use disorder or who are prescribed chronic opioids for pain, please note that Mayo Clinic is taking active measures to ensure your well-being and to meet your needs. We have come up with multiple tools for pain management that include non-pharmacologic treatments as well as non-opioid related pharmacologic treatments. And we feel that this will complement very nicely in a holistic way in managing your chronic pain. If you struggle with opioid use disorder, clinicians and nurses and other allied health staff at Mayo Clinic are arming themselves with the appropriate knowledge to help you and your family members. We understand that we need to arm our nursing staff as well as our provider staff with the appropriate education and tools to do this. We've rolled out significant nursing education campaigns, both for our inpatient as well as our outpatient nurses to help screen patients with opioid use disorder and then subsequently know what to do. In regards to our clinician staff, we've embedded an opioid use disorder screening tool in the electronic health record system so that patients can actually complete the initial part of the screening themselves. And if they screen positive, we offer the appropriate guidance to our clinician staff on how to address these issues. For example, we've created an algorithm on how to screen for and properly diagnose and then subsequently initiate treatment in both the outpatient, inpatient, as well as in the emergency department setting. And we've housed all of these guidelines again in our intranet platform called Ask Mayo Expert. We've also made collaborations with various leadership in departments such as addiction psychiatry, as well as hospital internal medicine in the emergency department to better coordinate care to offer these patients the best treatment appropriate. We know that with the enactment of the MAT Act, MATE, we know that our prescribers need to meet a one-time 8-hour CME requirement on opioid prescribing, as well as content on substance use disorder and opioid use disorder. And so our group have actually created content on education to arm our clinician staff on how best to diagnose and then subsequently treat patients with opioid use disorder. And to date, we have success to show for this. In regards to opioid prescribing, we have seen a decline in discharge opioid prescribing. We have also seen that concurrently, even though our opioid prescribing has decreased, the patient experience and the patient report of pain management in the hospital has not changed. In fact, their perception of pain management and control has actually improved over time. And we have seen a corresponding increase in the number of patients who are now prescribed buprenorphine, which is one of 3 FDA-approved medications to treat opioid use disorder. We still have a long ways to go, though. We understand that the opioid epidemic is not over, despite recent declines in numbers. And we continue to involve ourselves in monitoring our own metrics, continuing to involve ourselves in the communities in which we serve by participating in activities like local drug take-back days and also participating in opioid settlement funds groups. I'm hopeful that over time we will continue to see improvements in the number of deaths and overdoses in our country. And we hope this manuscript will serve as a guidance to other institutions on what we've done at Mayo Clinic to improve our own metrics, as well as to optimize our patient safety and well-being.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.